Ambulance service, is the patient breathing?
Hello, I have an ambulance service.
Okay, is the patient breathing?
No, Dad, is she breathing? No, she's not.
Okay, what's the address of the emergency?
Every hour of every day, West Midlands Ambulance Service receives nearly 200 cries for help.
1 and 2 and 3. I think he stopped breathing.
Bleeding out. He's literally bleeding out. He's been shot. Yeah, baby, he's just looking out.
This is the story of just 2 12-hour shifts.
We're going to need 4 or 5 ambulances over.
From the critical decisions in the control centre on who gets care.
She's just going to have to wait, isn't she?
Yes, unfortunately, I'm not leaving a 16-month-old.
To the crews saving lives on the ground.
She's breathing, mate, she's breathing, OK.
I've just had a really bad job. Most of the people were dead.
Cameras capture the beating heart of our NHS.
They're coming as fast as they can. I'm going to stay on the line with you, OK?
We are extremely busy at the moment, and we are trying to get to people as quickly as we can.
I need to know. Where are they? Please let me off. Ambulance service, is the patient breathing?
Yes, I hope so. The problem is I've gashed my elbow and I've spent the last 2.5 hours trying to stop it bleeding, but I can't stop it.
OK, my love, all right. Can you get a clean, dry cloth or towel?
Trouble is I can't get to anything because I can't walk.
No, OK.
I'm 96.
Oh, love. You're fairly remote. Is there anyone else there with you, love?
No, I'm on my own.
Right. Case in Ledbury. D, my guys are up in the hospital at the moment and still got jobs outstanding here. I've got a couple of urgents.
There's nobody over that way, and the area is so fast.
Seems to follow a bit of a pattern, doesn't it?
West Midlands Ambulance Service responds to calls across a region that covers over 5,000 square miles. It stretches from Stoke to Stratford-upon-Avon, taking in Birmingham and out as far as the towns and villages of the Welsh borders, caring for 5.6 million people.
Uh, 4451 over.
451, thank you. Just sent you case 175 in Ledbury, please. It's a little way to travel. If we get anybody closer, then I'll let you know, but at the moment you are the nearest resource, over.
Yeah, all received, and we're en route over.
999 mode activated.
That's all received, thank you for that. Standing by.
I'm just going to assess your bleeding loss, love. Would you have filled an average coffee mug in the last 30 minutes?
Yes, blood's pouring down my arm and across the carpet and in my bed and everywhere.
Oh dear.
Roads are deserted virtually, aren't they?
Mark and Niall must drive 16 miles on blue lights to get to the patient.
I hate this road, boys. It goes on for ages, the M50, and then it just drags.
It's about 22 minutes, I think, now. Let me just double check that.
Just gone past junction 2?
Yeah, about 22, 23 minutes at the moment to get to that one.
Of course, at this time of night, the motorway should be quiet as well.
It's made me very shaky.
I will stay on the line, sir, and I have arranged some help, though.
What is this? A first responder or...?
It literally is whoever's free.
Well, I was an ambulance man for 6 years.
Were you?
Back in the 60s, yes. I deliver my own daughter.
Oh, wow.
I was very scared when the head came out and opened its mouth and bawled. I nearly dropped it. Yeah.
Oh, wow, that's a lovely story. They are still on their way, my love. They will let me know when they're close.
Okay, thank you.
I went to something like similar the other day, came through, been bleeding for hours and hours. There's a little paper cut.
Why'd you get sent to a paper cut?
It came through as trauma.
It will be at least a 20-minute drive before Nyala and Mark in ambulance 4451 can assess their patient. 55 miles away, a high-priority call has come in.
Ambulance services.
Ambulance, please.
Okay, I need to know, is the patient breathing?
Yeah, he's taking deep breaths, but you need to hold.
Okay, what has actually happened?
Someone stabbed him.
An ambulance crew is dispatched, along with an operations manager, to coordinate the scene. Serious incidents also require the medical emergency response team, Merit.
It's a stabbing. Run Merit. So that's Mike got a 9-8 at Alistair. Sending a stabbing.
Yeah, received, have it.
Coming through as unconscious, although normal breathing.
Yeah, received, mate.
Merit crews' advanced training means they can perform surgical interventions on scene.
So somebody blood, please. Please come quickly, bleeding out.
We are getting help.
As quick as you can, please.
Have the people that stabbed him gone?
No, I haven't gone outside.
Critical care paramedic Pete is 8 months into his role. He's crewed up with Matt, a doctor who specialises in emergency medicine.
You said we'd have a stabbing tonight, didn't you?
Unfortunately. 9-8.
9-8. Just looking at where you are and where this job is, you might be first on scene, so just be cautious, because I don't know where the person with the knife has gone over.
Yeah, that's received. We'll proceed with caution and stand off if needs to be.
But just, yeah, stay safe over.
Police are dispatched. They will make the scene of the stabbing safe so that the crews can enter the area.
You are coming as quick as we can. You need to stay calm, okay?
Pete and Matt are still at least 5 minutes away from the incident.
I still see myself as new to Merit. As a paramedic, you see them turning up on scene. It always looks really exciting, and that was something that attracted me to the role.
Get a dry dressing or a clean cloth and fold it into a pad and press it firmly and directly onto the wound.
I'm not sure where the wound is, I'll be honest, I'm not sure where it is.
Call us saying that patient's covered in blood and doesn't know where the bleeding's coming from.
Received.
Because of the nature of the jobs, we tend to see more time-critical, seriously injured patients. The adrenaline kicks in, you know, your heart starts racing, you think, are we going to be able to help them? It's very challenging and really exciting. For me, it's got the best job in the world.
Go outside, see if you can see the ambulance, okay?
I can see them coming now, yes. Okay, the police is there now. They're here. Okay.
Guys, you need to quickly...
You right, mate? Can you hear me? This guy is just about barely breathing, guys, here, so probably bag a mask out next, mate.
Okay.
And an eye gel ready for the top. And he might be a thoracotomy case.
Yeah.
So can I get you just to attach some pads on him and we can see what sort of output we've got? And Pete, if you can start bagging, I think I've got a pulse at the moment here. So I think priority, let's get these get the hemorrhage under control. We'll try and get some access. Just make sure we got there.
A main artery has been severed in the attack. The patient is losing a critical amount of blood.
Can we tip his
Guys,
head back a bit to get
can we just stop and just do a quick look at him? Yeah. Okay, because I've got no movement on that ECG there, and I've got no pulse. Okay, this patient's going into cardiac arrest now. We've lost the central pulse. He's got a central stab wound. We've decompressed both sides of the chest, and we've got a tourniquet on there. So next step, he's within 15 minutes, so I think we go for thoracotomy on him, okay?
Right, yeah.
Do a few ribs here, guys.
Matt decides to open the chest to identify the source of the blood and manually massage the heart to resuscitate the patient.
So at the moment, I've got what looks and feels like an empty heart. Without any electrical activity at all.
Okay.
I think we give him one adrenaline, see if we get any sort of output on the heart. If not, I think we stop, okay?
Okay. Okay, so we've got an adrenaline, 1 in 10,000 adrenaline for cardiac arrest.
The team carry out advanced life support for 15 minutes.
Guys, there's no cardiac movements there. So from a reversibility point of view, pre-hospitally, in the environment we're in, I don't think there's any purpose in continuing resuscitation with him because we can't deliver the volume in the volume he needs and the speed that he needs to get him back. So my view would be to stop resuscitation at this point. Does anyone have any major objections to that? Okay.
In an average week, crews across the West Midlands respond to 30 stabbings.
5-5, thank you, advocacy. The patient confirmed deceased by the doctor on night Delta 9 capacity.
Delta Yankee 5-5, thank you. Yeah, it's trauma desk here. Yeah, thank you for that information. I'll speak to Doc on 9-8 shortly. Thank you for that. The patient is dead.
Jump on board, guys, and we'll have a chat through quickly. I mean, it's not the nicest thing to see, and it's fairly brutal, and there's no finesse about it. It is hacking into someone's chest to get to their heart as quickly as you can. Yeah, I don't blame you if you feel a bit shocked by it all. Has anyone got any questions about it or any queries that are floating around their head?
Would there be much difference if we scooped him on?
It'd taken a while to get him down the stairs, wouldn't it? And out of there, it would have been treacherous, wouldn't it?
But it's good to ask the question, and I think it's really important to vocalise that if it's in your head, because you don't want to go away thinking, what if?
That's all understood. Thank you very much for that update. You all okay? That's really sad.
It is really sad.
You have reached your destination.
It looks like we're just coming round to you, Jim.
Okay, thank you for your help.
I don't go chasing the trauma jobs. You know, I'm quite happy for other people to have those. I'm quite happy to go and pick up the old lady that's fallen on the floor and pick them up and have a chat.
Further up, past the junction.
I started out in the Air Force and I was on a mountain rescue team for 8 years or so.
B1
one of these down here.
Well, I was a novice. That was 1988 then. And we were going up to Scotland for our Christmas break. And the phone rang, and I think it was Edinburgh Rescue. We've had a 747 go down over Lockerbie. We can get past there if anybody comes by.
Arrival route activated.
We got into Lockerbie and it was just chaos. It looked like a war zone. I'll bring the orange bag.
Yeah, cheers.
And you could just see the flames.
Hello. Right.
It's Jim, is it?
Jim, yeah.
Jim.
Let's have a look at that.
When a right bloody mess, aren't they?
The idea was to search field by field, looking for the bodies.
God, bloody.
So we spent 2 days doing that. We thought that incident was a tragedy. But obviously later on you realise it's probably one of the biggest mass murders in British history, really, because it was murder, wasn't it? It was, you know, it's a bomb.
How long ago was the injury? Day after Christmas Day. I was driving my electric scooter.
Okay.
And some people got in my way and I slid off the edge of the curb and it threw me across the road amongst all the traffic.
Okay.
Gouged on my elbow and the nurse in the local hospital is doing a dressing every day, but the one yesterday obviously didn't work properly.
No. So have you knocked it or anything?
No.
No?
Not since then.
Okay.
Just started to run down my arm.
Are you on any sort of blood anticoagulant?
Yeah. I've had 2 strokes this year.
Okay. It's not bleeding, isn't it?
No. It's coming out. It's making a mess.
Oh, you want to see the bathrooms and the...
I've just had a look.
Yeah, and my bed.
How does that feel on your arm at the moment? Not too tight, is it?
No, comfy.
Yeah. Right, we'll just see how that copes with that. That's what men do when they cut themselves. Bleed everywhere. Everything that we see as people and do shapes us, doesn't it? Makes us who we are, gives us empathy towards others. New pyjamas. You know, we value life so much differently, perhaps. All your dirty washing's gone in your laundry basket, okay?
Wonderful.
So I think all the beds have been done, haven't they?
Yeah, it's all pretty much tidy.
Beyond the Call of Duty then.
But, oh no, not really. At least, hopefully if that doesn't bleed through again now, they should be able to stay at home and at least it's a clean place for you to stay at home. All right, rather than you try and clean it up and have an accident. Do you want a cup of tea?
Would that be a good idea? Tea bags,
Oh, I'll find them. If I've been thinking about those big trauma jobs, there's been several of those. That's why I let the young people do the trauma jobs. You go for it. You know, so definitely prefer the social side of things. How'd you like it, Jim?
Very weak.
Very weak. That's unusual. If that's too weak, I'll put it back in again. All right. that going to be too
That's
hot?
okay, that's fine.
Is it?
Yeah.
It's like dishwash water, that is.
Yeah.
What line of work were you in, Jim, did you say?
I was a radio engineer with the airlines.
Were you in the Air Force at some point?
Yeah.
How long were you in the Air Force for?
5.5 years during the war.
Where were you based? Or?
Well, up in the north of England to start with, and then overseas to West Africa.
Enjoy your time in the Air Force?
Oh yeah, yeah.
Even though it's
Best
during a
time
war?
of my life.
Yeah.
Met my wife when I was posted overseas, and 70 years later,
Wow.
I was still with her.
Fantastic.
Mm.
So you've got the Air Force to thank for that, really?
Yeah.
And your posting? Yeah, cracking. If this bleeds tonight, you notice it again. I mean, it's only a few hours left until the morning. You can call us back if you're concerned about it. How will you get down to the minor injuries unit tomorrow? On your mobility scooter?
Mm.
Oh, fantastic. Should we get you to your bed?
Yeah, we can do.
Yeah, it's not come through now. I'm hoping it'll stop it. Right then.
Oh, where's my stick? I've lost it.
It's just, here we go. That's better, isn't it? Nice and steady though.
Really weak and feeble.
I went to the Falklands on one of these.
Did you, be good?
Yeah.
Well, I worked on
16-hour flight, I think it was.
Well, I worked on that one.
Yeah.
I worked for this because we do.
Good aircraft they were.
Yeah.
Oh. Hey, lots of blankets there.
Well, thank you for your help.
That's all right.
Probably fall asleep.
Yeah, hopefully. Yeah, get a few hours. Okay. All the best.
Thank you very much.
Right.
Okay.
Bye.
Really appreciate that.
You want this off, yeah?
Yeah.
Okay, we got a key to lock up. haven't we?
Key safe in there.
Alright, do you want your lights on in the lounge or off? Off. Okay. Nice to meet you, Jim.
And you?
Hi, Royal Stoke. You put me through to the site manager, please. It's West Midlands Ambulance Service. Yep. Thank you.
Strategic Operations Commander Lee manages the flow of patients being transported to hospitals throughout the region.
I'm just ringing up and tell you there's 7 vehicles on the way in at the moment. I know there's only a couple there, but there is 7 on the way in, so... You know full well that today's going to be another busy day. No. Yeah. Okay. Thanks. Cheers. Bye-bye. 125 patients still in ED. Resources plus 4 plus 3. There's 26 in the corridor.
Oh my God.
So that could be the challenge for the day again.
Across the West Midlands, there are 251 ambulance crews on shift, with more than half currently deployed on cases. 30 of these ambulances are stuck outside a hospital, unable to hand over their patients.
Ambulance service, is a patient breathing?
Yeah, she's been unconscious. She's been on the floor for most of the night. Could I have ambulance, please? My wife. She's got very bad palpitations.
She unconscious at the moment.
Yes, look.
Can we have your attendance on the cross in Worcester? Is the patient breathing and conscious? Breathing, but not responsive. So police are already on scene? We are within, yeah.
Police in Worcester have found a man collapsed after a suspected drugs overdose. Crew 4449 have been dispatched.
That's the way, people.
Chris and Christine are 7 minutes away.
A bit of drama to start the day.
I've got a funny feeling this might be a
Regular.
A user, yeah.
Police have been with the man for 10 minutes, but he needs emergency medical care.
Yeah, I'll just hear, look. It's the Cancer Research Charity Shop. Yeah, he's using.
There's no sense to it.
Good morning. Should we just get him down to get his airway?
Got his head?
Yeah. OK. Can you hear me? Good morning.
Do you know him?
Yeah, I do. So we believe he's had heroin and we believe he's had some Valium. Valium. OK. Can you hear me? Good morning. His pupils are a 2 at the moment. Rest dropped to 10 because he's unconscious. Let's cut his jumper off. And I'm going to have to cut your jumper off, sweetheart. I'm just going to put the pads on him, all right? All right. His rests are dropping off again now. Do you want to get some Narcan out for me?
Yeah, sure. Got some IM Narcan to start with?
Yeah. Yeah. All right, just going to give you a little injection.
Christine uses an opiate antidote to reverse the overdose. It can prevent a patient slipping into a coma, but its effect is only temporary.
Can one of you gentlemen get a blanket out of my vehicle for me, just to give him some dignity while we're... Thank you. All right, my darling. OK. Yeah, yeah. Can you hear me? Good morning. Can you hear me? All right. Now he's waking up a bit now. All right, my darling. Take some nice deep breaths for me. Well done. I think I've been coming to him for about 20 years. All right. I haven't met him for a while, though. All right, let's get you in. You're cold. We're going to get you on the ambulance.
Come on, open
Come on,
your eyes.
I'll sit you up, mate.
And we'll turn this the other way round. No, it's all right.
You are in Worcester. Good morning. I haven't seen you for a few years. Where have you been? Hey?
Brakes aren't working.
You are?
I'm all right, mate.
Are you all right? Let me take these off you. Just hold on, because we've had to cut your top.
What?
We've had to cut your top.
Oh, my God.
He's going to kick off, big star. Right. He will kick off. Let's get you on this bed.
No. You fucking taking a piss.
You were unconscious, mate.
I don't give a shit, man. I've got no fucking guns in Japan prison.
You were unconscious. We needed to get to you. You weren't sleeping, mate.
Fucking was.
Your breathing was starting to go.
Fucking sleeping.
Let's get you on this bed and we'll get you up to hospital and get you checked out.
No, I'm going to go to I feel fine. Fucking hell, man.
You were unconscious.
Fuck. What are we going to do about that?
Do you want to get on here and we'll get you in the warm?
Come on, mate.
I don't want to fucking week off. My eyes are fucked up.
And that Narcan's going to wear off that I gave you in a minute. Let's get you on our bed. Come and sit on our bed. He's going now, look. That's going to wear off in a minute. Hmm?
There you go, look.
Come and sit on here.
That. Do you want to sit on a chair in here? Huh?
Can I take some blood out your finger? Huh? No. Why don't you let me? I'm only trying to help you. Hey? All right. All right. I'm only trying to help you, mate. Come on here. Come on. I'm sorry about your top, but I had to get to you, mate.
Please, you go now. Please, you go now.
Somebody's going to need to come in, maybe.
You're not in any trouble at all, don't worry about it.
You're not.
We're just here to make sure you're going to be OK.
That's all.
Nothing's going on file, you're not going to get arrested, there's nothing to worry about, OK? Just purely your health and welfare, that's all.
Can you hear me? Open your eyes. He's going again. Did you get some more Narcan?
The charity shop has donated him a new shirt.
Oh, that's good. He wasn't very happy about me cutting his top off. That soon woke him up, though, didn't it?
A member of staff once said to me,
You're the Nanny McPhee of the ambulance service.
All right, mate.
I love supporting and mentoring new staff. A lot of my students call me their work mum. I'm old enough to be their mom.
Hi, it's Chris here, paramedic, Worcester. I've got a query heroin overdose. He's had 8...
I think you have to be able to switch from being nice and soft.
Fast asleep, sleeping like a baby now. Yeah, good to go.
To being assertive.
I first met him when he was about 16.
Yeah, there's a few people like that.
This makes me feel old now.
Yeah.
I've never known anything else other than the ambulance service. It's something I've done since the day I left school. I grew up in a village in the Shires. I wasn't a very confident person. I was very naive. I hadn't really seen a lot of life.
We're here now. You gonna open your eyes for me? There you go, we're here now, we'll get you sorted.
I think I've grown within the role.
Thank you.
Dee, nothing going over your side. Have you got a lot outstanding at the moment, or...?
Not great, to be honest. I've got massive delays and I've had to send a crew down to cohort some patients that we can't hand over. So it's not good.
There are now 54 ambulances delayed at hospitals across the West Midlands. The average wait to hand over patients is almost 40 minutes.
Hello, control room, it's Lee, one of the stock commanders from West Midlands Ambulance Service. Hello. The big wide world is busy now. It's all going wrong regionally. Worcester's not improving. Resources full, everywhere's full, there is nowhere capacity left to put anyone.
Lee needs a plan for where to send the next set of patients.
So you've got some capacity coming up?
He constantly checks with the hospitals on whether they can find beds.
OK, have you got a time frame at all, or is that just... OK then, thanks. Cheers, mate. Drop away. There's nowhere to go. There is nowhere to go, though, that's the thing.
Yeah, have an ambulance, please, quickly. An old lady fell over and smashed her head.
We have arranged some help for her. We'll come as soon as we can. We are extremely busy, OK?
West Midlands Ambulance Service has received 1,280 calls so far today.
My mother, she's taken an overdose.
Right, OK. What's the address?
22% up from this time last year.
I'm his carer. He's pale in colour, he's been sick all over himself, and he just keeps shaking.
Whiskey Mike 24422, treble 9 call for you.
90-year-old male patient, vomiting, pale and shaky. The patient also appears in shock. Received, over.
4422, yes, that's all received. Thank you, over.
Tracy and Joe have just become free after being stuck at Royal Shrewsbury Hospital for almost an hour with an elderly patient with chest pains.
The chances are we're going to be queuing again with this patient, aren't we?
Yeah.
Hello, young man.
Shall I, Dennis? I'm over here.
Sorry.
You've been a bit sick this morning.
Yeah.
OK. How many times?
Half a dozen times, okay.
How do you feel now?
I don't feel too bad, no.
OK.
It was Dennis's carer who called for an ambulance.
So, is it his eyes look sort of half shut? Is that how they they're not normally like that? OK. So when you got here,
He just looks really grey in colour. He was
Right,
shaking.
okay.
I just looked at him and I just thought, no.
He's not well.
No, he's not
so,
well. Just keep still a minute, Dennis.
No, 37.5.
You get on to...
Feels warm to me.
Dennis, can I just have a little listen to your chest?
Yeah, all right.
His chest is nice and clear.
Oh, yeah.
So, my lovely, we haven't got a temperature at the moment. Blood sugar levels were in, because with the shaking, perhaps you thought sugar levels might have dropped low. They're within normal parameters, so that's all normal. So for us, there isn't anything glaringly obvious.
What are we going to do with you, Dennis?
I'll get over it.
Well, do you have a number for Dennis's surgery, please?
If we can get the GP out, if he feels that he needs to go in, he can perhaps arrange direct admission.
Go in, yeah.
We're just waiting to speak to the doctor.
Yeah.
And see if we can get the doctor to come out and see you.
Yeah.
Yeah. It's been on hold 4 minutes now.
Okay, don't stop now, but tell me, when did you last see the patient alive?
About 10 minutes ago.
All right, don't be scared to go too hard either, okay? Push down hard and fast.
Please, somebody help me.
We're coming as quickly as we can. Keep going for me.
You say she's having an urge to push? So he's still on the floor at the moment, and is his head bleeding still?
How long has she been fitting for at the moment?
There is a new emergency call every 18 seconds.
I'm sorry, sir. We'll be there as soon as we can.
An ambulance will be responded as soon as possible. As you're probably aware, we're extremely busy. The first available ambulance we have in your area, we will send to you, OK? OK, we're with you as soon as possible.
With calls stacking, the ambulance service must prioritise who is sent an ambulance and who has to wait.
Come on, you bloody old bastard. You ain't going on me.
No, it's difficult. We're literally just pulling up outside, OK? So go and open the front door for me and then come straight back and carry on.
Yeah.
As quick as you can.
Oh my God, I'm worrying now. We'll take over now, please.
Oh, how fickle life is. She was only sat talking to him 5 minutes before that call. Ambulance service, is the patient breathing?
Yeah.
Patient conscious?
Yeah.
And the reason for the call, what's happened?
71-year-old female who's got breathing problems. She's conscious. End-of-life patient with lung CA.
Chris and Christine are dispatched to a cancer patient who's already been waiting almost 40 minutes for an ambulance.
She's got a terminal illness, hasn't she?
Yeah.
Her doctor called 999 as he suspects neutropenic sepsis, a life-threatening infection as a result of chemotherapy.
I couldn't imagine not doing the job I do.
Next to it, not this one. It's the next coolest shop by the looks of it.
But actually, when I started working with the ambulance service, I worked in the control room, taking phone calls.
Let's go there for a moment. We'll see where we are and then...
I went out and did a shift with a paramedic just because we had a little squabble on the phone. He thought my job was easier than his and vice versa. And I went out and completed a shift. And I can remember sitting in the back and thinking, I'd love to do this. This is me. And I've never looked back.
Hello, sir.
He's got non-small cell lung cancer.
Yeah.
Phoenix, he's in the second cycle
Of chemotherapy?
Yeah. She's been having Filisgram injections to boost the white blood cells.
Yeah.
Steroids. She's in her second week.
I've got it in my brain as well.
Yeah.
My speech has gone terrible.
Oh.
Yeah, because we're not sure whether this is chemo-related or the brain mets.
So the doctor's been out. He said that she's got possible neutropenic sepsis.
Possible.
Yeah. All right, well, we're just going to do some obs. Is that all right, Teresa? Are you happy for me just to have a quick listen to your chest? All right, my darling. Yeah, we've got crackles, lower right lobe. You're very warm. Have you been having paracetamol, my darling?
She hasn't had paracetamol today. Oromorph, she had that at 5:30 this morning.
Okay.
Cyclozine, she had it 7, I think it was.
So she's had no paracetamol
No
today?
paracetamol
Okay, that's
today,
fine.
no.
Okay.
In my bag, I've got what her drugs is she's been having today. Do you need that?
Yeah, all her tablets and that, yeah.
What time will give me?
He's very organised, isn't he? Hey?
And everything.
Is he? Has he always been like that? Yeah.
He's very housebound.
Yeah, but it saves you having to do it. Oh, God love you. Right. Yeah, what's this, my darling?
That's my bell.
Your bell?
Ring my bell. And it rings downstairs.
Do we one of them?
Very clever.
Hey? He's done that for you. Is it one of those?
He doesn't know at all about.
Oh, bless you. So, Teresa, what we're going to do now is get the ambulance ready for you, and then we'll carry you downstairs.
That's fun. Worcester Hospital's brilliant. Brilliant. Don't want him back ever. Anything.
The staff at Worcester's fantastic.
But the waiting time was 6 hours. The corridor last time was 6 hours. And I couldn't do that again.
We was in a...
It was amazing.
Because she was, again, neutropenic.
Yeah.
And everybody's puking up everywhere.
Yeah.
And I was so concerned that she's very vulnerable.
When we leave here, I'll ring A&E directly and pre-warn them that we're coming in.
Thank you, please.
No, don't thank me. Don't thank me.
It's been emotional.
I can imagine it is. At the end of the day, she can't really be in a corridor with 10, 12 people when she has got no immunity. How long have you been diagnosed, Teresa?
18 months.
And we've been fighting ever since.
And you've got to keep on fighting it. Oh.
Right, I just got to get my bag.
We're going to wrap you in a blanket and we carry you downstairs.
I gave up work. As soon as we knew the diagnosis, I jacked in work and I'm going to look after her, you know. And we've managed so far, but it's coming to a critical time now. So I think after this, we might have to have a decision whether we try another... This is the second time she's had to go in hospital with the chemo, whether it's not do anything, you know.
Do you want another sip of water before we get you on this chair?
We call it the relentless. We don't call it cancer, we call it the relentless because there's no rest from it. At the end of the day, it's a shit thing to have. All right, baby.
Go on your lift.
All right, on 3, 1, 2, 3. Okay?
Yes.
Come here, my lovely. Hold on to me. Okay. Oh, well done. Well done. Right, let's get your legs up and I'm going to get you all nice and cosy, yeah? Just pop that behind your head, my darling. I'm just going to give them a ring because the corridor was very busy and... Hi there, sorry to bother you. It's Christine here, one of the paramedics. I'm coming to you with an expected patient. She's a possible neutropenic lady. She's in between her chemotherapy, and I noticed the corridor was very busy. I didn't really want to come into the corridor or stay any length of time because she's obviously at risk. All right, then, that's fine. I'll explain to the relatives and patient. All right, thanks. OK, bye-bye. So, at the moment, they've got no beds, but from us like leaving here and getting there, they'll hopefully get a cubicle or room. So that's why I thought it's worth ringing.
Yes, yes.
OK, chaps.
Yeah, because in the news at the moment, it's all doom and gloom about the hospital.
Yeah, and the thing is, the staff, they're doing everything.
Yeah, and then you manage with what you got to, don't you?
Yeah.
You're like magicians.
Well, we try.
Yeah, it was like utmost respect.
Tracy, do you want to lie back a bit, or are you all right like that?
Fine, yeah.
Do you want me to turn these big lights out? Yeah. Okay. And we'll put some nice little spotlights on for you. Yeah? It's a bit comfy on her eyes. You all right with that, my darling? Yeah?
Fine.
Yeah? OK. It's a bit better anyway, isn't it? As you know, the trouble being there's so many bugs and germs around this time of year. And with going through her chemo, she's got no antibodies to fight anything, so she's going to be open to.
She has suffered.
Oh. Very lucky to have a very caring husband. You look after each other, I'm sure, don't you? Bless her.
I've got different rubbish music now.
GP surgeries are also feeling the pressure. Tracy is still on hold trying to make an appointment.
This is really difficult.
It is, isn't it?
Because we're trying to avoid A&E for Dennis, but I wouldn't be happy in leaving and not organising a GP visit.
When I go from here, that is on his own then.
Yeah, exactly.
Back at 5:30.
Yeah.
I think we're going to have to take him.
OK, yeah. I give up. We have tried our very best.
I'm not sure.
Thank you ever so much, ladies. You've been a real help. Thank you.
All right there, Dennis. It's a bit bracing out here.
2, 3. Dennis, there's a lot of ambulances at the hospital, so we might have to wait for a little while in the corridor before you see a doctor.
Yeah.
But Joe and I will stay with you.
If you say so, Gaffer.
You happy in the back?
Yeah, we're good to go, Joe, thank you.
The crew is taking Dennis to the Princess Royal Hospital in Telford, where there are already 5 ambulances waiting to hand over their patients. 57 miles away, at Worcester Hospital, Chris and Christine are joining 9 other crews who are experiencing delays of up to 2 hours.
The hospital now, babe.
Yeah. We're going to stop in a sec.
We did call in on a heads up. We got a query neutropenic GP sent in. They're trying to sort stuff, but it is proper broken.
Is it?
Yeah.
Oh, in all fairness, I'd rather stay in here with her because it's just my germs.
I'm warm now.
And you're warm now? Good.
Just let you know we are trying.
Yeah, that's OK.
Brilliant.
See, they're under so much pressure.
"78 of the 350 ambulances on shift are now delayed at hospitals.
If you could just let me know, that'd be great.
OK.
All right, cheers.
It's going pretty bad across a number of places now. Heartland's very busy again, but not causing any problems yet. Hereford have had some cohorts. Yeah, Worcester, well, we're outside on vehicles now. Don't know how they're surviving, but say there's another 6 ambulances to come behind that, so obviously conditions are getting worse there. But the problem is every hospital that we deal with is now full to capacity, and there's still quite a number of jobs outstanding in Worcestershire as well, so we are struggling.
Delays across the region's hospitals are becoming critical, tying up almost a quarter of the ambulances on shift. Strategic Commander Michelle's job is to take charge of the worsening situation.
So, have they opened up the corridor? So, when you say they're in the shower... No, but if... I'd... OK, what about the ITU corridor? Well, they're going to have to do something because they can't have patients sat on the back of ambulances. So if they refuse to open that? Yeah. OK. OK, so they need to open that corridor.
She's using it as 6 now. 16 trucks here. You comfortable, Teresa? If your bottom starts hurting, let me know.
It's hurting.
It is? OK. We have a problem here. We're just going to have a word to see how long. We have got an open pressure sore on her bottom, and she's in some discomfort.
Do you need a new bottom?
Yeah, she does, yeah.
OK, I'll go and ask.
So I'll put a smaller cuff on. That's far too big for your arm.
Yeah, she's lost a lot of weight. Isn't you, baby?
Did you want a sip of water, Teresa? Yeah? Can I put this back on now?
Yeah.
Yeah, it'll drop in again.
Okay.
Nasty chest infection, aren't you? So I'll leave that there. I'll give it to your husband and he's got it then if he needs it. All right.
That's my wife on our wedding day.
Oh. Bit of a stunner on your wedding day.
Huh.
We're going to go into that little side room. There's somebody else in there, but...
There's another patient in there.
Yeah.
I would rather stay here.
Do you want to go and see?
I ain't having it.
Is there another patient over there?
Just relax, OK?
It's over there, be room.
Yes, I know. Don't worry, it's being sorted.
I'm worried.
You just relax on there.
Yeah.
You're in the best place, to be
We'll
honest.
do the worrying and the sorting, you just relax, OK? Just relax, we're sorted.
Okay.
Being on the front line, the demand has increased immensely. Whatever role you're in, whether it's the police force, whether it's the fire brigade, whether it's the hospital staff, there is a lot more stress and it isn't getting any easier.
It ain't happening.
Staying on here.
I said, my patient is not coming off my vehicle and going in a small room with another patient that potentially could infect us, so it ain't happening. So we'll sit here till you've got a room. So we've got a room coming up, they're just preparing it.
Oh, it's brilliant. Thank you ever so much.
I promised you wouldn't, didn't I?
She's like you, she's all guns blazing.
That's the thing. You're my priority, Teresa.
Thank you.
You're more than welcome, mate. You'd do the same for me, wouldn't you, Chuck?
Yeah, they would.
Good for you, Chris.
Hold on.
Good for you. They're going to move you now.
An hour and 20 minutes after arriving, Teresa can finally leave the ambulance and be admitted to hospital. 12 crews are still waiting and unable to accept new jobs.
For everybody at this time, it's an extremely hard job.
I'm sure This keeps my thigh muscles in order.
And just keep positive and do the best I can. The day I can't help a patient, that's the day that I'll give up.
My soul is yearning, and I'm longing to see my day turning, see me breaking through. My time is coming soon. So I'm waiting, I'll be waiting for you, my friend.
Next on Ambulance.
4453. It is a bit of a strange one. We've had the call, I believe, from a member of the public.
Patient has proceeded to just put a lot of tweets about they want to end their life.